First of all, they provide, the only cancer screening they provide are pap smears. I know, I've asked. They do not do prenatal care. In the January 8th Waterloo Courier, right off the website, it took what Planned Parenthood provides. They also say that they are needed. Look at this. There are 12 now, not 13 Planned Parenthoods. There are 213 public clinics that provide the same services except abortion. Planned Parenthood says they need to go and they cover rural areas. I'm glad Cedar Falls is a rural area. I'm glad the 3 places in Des Moines are rural areas. I'm asking you to seriously consider reallocating the taxpayer money that goes to Planned Parenthood and put it in to other places, health clinics that provide the same services. And I was interested also right now, there's a current court case of charging Planned Parenthood with Medicaid fraud. And it's gone through three levels of court. And Planned Parenthood has fought it, and they've lost in each area. Also, Planned Parenthood performs an abortion by statistics every 97 seconds. And I'm talking to you for 2 minutes. One baby has been aborted, and before I sit down, another one will be. I'm asking you to look at the facts and figures and seriously consider. I don't want my taxpayer money going to a place that provides abortions, and that's their main job. Thank you.
So thank you, Barb. We are one of the group of usual suspects who show up at these forums. We're always happy that you're here and
Sure you are.
your passion. Well, the only thing I'm missing this time is the cookies. I didn't see any.
I was going to make gingerbread people and say she's a baby, but
So we know where your passion comes from, and we appreciate that. There is now what's I think called Senate File 2 that would ostensibly defund Planned Parenthood, which basically says what you said: no taxpayer dollars going to termination of pregnancy. The problem with that concept is there are a lot of health providers who do not provide termination, who are going to get caught up in that bill and that law and lose the opportunity to provide the services that they currently provide, and they have zero to do with Planned Parenthood. We just met with one of the most successful women's health clinics in the country. Allen, now known as Unity Point, has shown tremendous statistics on planned pregnancy and preventing abortions. The way the current bill is written, their funding will be in jeopardy too. And they don't give 2 hoots about Planned Parenthood as a business model. It's not who they are. So I would ask those who are as passionate about this issue because of your goal, reducing the number of abortions, that's the goal, that you would put equal energy into making sure that when you swing to hit Planned Parenthood, you don't cause damage to community health groups that have nothing to do with that. They're trying to help people have planned pregnancy or prevent abortion too. And we have really, really good statistics here in this area. Long-term birth control has driven down abortion rates in Iowa like you wouldn't believe. Which in the end reduces abortion. So I hope the passion is matched with the attention on making sure the law doesn't have unintended consequences.
okay, I need to talk to you about that because as far as I understand, the law says that if they do not provide abortion services, their money won't be touched. So I need to look at
They
that.
tier them, and they're lumping people together that have nothing to do with Planned Parenthood.
Barb,
Thank you.
I would just share too that based on the information that I've heard, the 213 better alternatives for women's health care, on that list is a dentist's office, and on that list is a school nurse. So I don't know if any dentists are going to be providing reproductive health care. Another piece that we have seen significant improvements, and that's with the types of drugs that prevent pregnancies, contraceptives. They've actually, what was that term that they, LARC, I think is another long-term program, but they've taken the numbers of teenage pregnancies down significantly. So I appreciate you coming and you talking about abortion. But, you know, the question that I have today is that why can't we, as a group, you're anti-abortion, and I'm pro-reproductive health care. Why can't we come together and figure out a way to make the reproductive health care work? Because with that, much of your arguments about abortions diminish and get less. And I'll tell you another one, that women's health clinic in Waterloo, 77% of the women that go there are below the poverty level. So that to them is the only way that they can get access to prevent, that type of medicine. So I think that in reality is what they call unintended consequences. I understand where they're at with this abortion issue. I totally get it. But let's focus on dealing with preventing pregnancies, because medicine allows us to do that. And I'll tell you the other thing, as a 63-year-old guy down at the Capitol, I'm not going to tell women what they do with their reproductive health.
I'd just like to add something. And one of the things that Barb, I know you really care about the birth of children, and I do too. But what they've seen across this country is every state that have stopped this and got rid of their federal funds and went after Planned Parenthood, the number of unwanted pregnancies increased and the amount of abortions have increased. And so your ultimate goal in trying to do the right thing is actually having an opposite effect. And I want to tell you, Pap smears are important because they're early signals of cancer. And we learned again today at the Women's Clinic in Waterloo that about what they do there and trying to work with families. And they're going to get caught up in this federal funding we're going to give it away. We're not going to get it. And Iowa taxpayers are going to now have to pay for these services in these other places. And they're very, very concerned about what they're going to be able to do there in Waterloo. And we're hearing that, well, don't worry, we'll forgive the $10 million from the federal government, and we'll get it from the Department of Human Services, and we'll take it from other services that are being provided, and a lot of it is about children and making sure after they're born, they're taking care of their life, for abuse and adoption services and health care. We worry about children from the very beginning, early pregnancies, all the way through to make sure parents, mothers have healthy babies, and those children get the service they have. I really believe that this bill is going to have the exact opposite effect of what you think it will, and I'm 100% against it. Thank you.
I need to share about the website. Thank you.